Good afternoon. I'm Eleni Tsigas, the CEO of the Preeclampsia Foundation, and super excited to be invited to this platform to share some exciting news. But before I do, just a quick show of hands. For any of you who have been pregnant or who have a partner who's been pregnant, who experienced preeclampsia or any kind of hypertensive disorder of pregnancy, HELP syndrome, eclampsia, what used to be called pregnancy-induced hypertension, or back in the old days, toxemia. Raise your hands. Do not be shy. And everybody, look around. I've got lights in my eyes, but you look around the room at how many hands are up. Hypertensive disorders of pregnancy are not rare. They affect close to 15% of all pregnancies in this country. Now keep your hands up. Keep your hands up. And those of you who are maybe to this side of this podium, you put your hands down. Everyone else, keep your hands up. Now look around, folks. As a visual illustration, those of us with our hands still up will die from heart disease. 2/3 of the roughly 300,000 women who have preeclampsia or hypertension in pregnancy every year will die of heart disease. Women with preeclampsia are 4 times more likely to develop chronic hypertension, and we're at double the risk for stroke and heart disease. And our first warning sign is our pregnancy. The facts are daunting. Hypertensive disorders of pregnancy, including preeclampsia, are a leading cause of maternal death and can occur up to 6 weeks postpartum, resulting in serious life-threatening risks. So today, we are announcing a new initiative aimed at protecting moms and preserving families during the very vulnerable days and weeks after giving birth. The strength of this initiative is drawn from the partners who stand with us and who have committed to harmonizing this initiative nationwide, spreading the news, the resources, and the training, and the message that all healthcare workers and new mothers must be aware of and act quickly upon any signs of postpartum hypertension. The good news is there is hope. It is estimated that over 80% of the maternal deaths in this country are preventable if and when care providers recognize maternal health risks in a timely manner and quickly intervene. For over 25 years, the Preeclampsia Foundation has advocated for a world where hypertensive disorders of pregnancy no longer threaten the lives of mothers and their babies. And with this mission at the forefront, today the Preeclampsia Foundation is proud to introduce Still at Risk, a new national initiative to prevent postpartum deaths and strengthen awareness of maternal heart health among care providers. Still at Risk will harmonize and standardize a postpartum patient wristband, a simple wristband like this. It will be used across all healthcare organizations and all points of care. Still at Risk is a simple, innovative solution to a massive care delivery problem in this country. A standard postpartum wristband can save lives, prompt critical patient and provider conversations, and enable emergency teams to quickly identify at-risk patients. Current efforts with similar programs are highly fragmented. Dozens of different colors and messages are used around the country. This undermines universal recognition and consistent care delivery. We believe that a unified national approach is needed to ensure mothers get the right care at the right time, no matter where they present for care. Our inaugural partners, many of whom are standing alongside me today, include the American Medical Association, the American Heart Association, Premier, Inc., the National Institute for Children Health Quality, and the National Network of Perinatal Quality Collaboratives, that is run by NICHQ, and especially the U.S. Department of Health and Human Services Office of Women's Health. Many other organizations are finalizing their agreements and will join this cause. We are extremely grateful for their support. And really for sharing in this vision of a standardized, harmonized postpartum wristband. Simple, but important. There is no better time for us to be announcing this Still at Risk campaign. The sense of urgency is real. Unfortunately, preeclampsia and hypertensive disorders of pregnancy are on the rise in this country, not going away anytime soon. The potential patient impact of Still at Risk cannot be understated. Mothers like Danielle Sapienza, who at 5 days postpartum was left seizing on the floor in her home while her husband was sleeping and unaware, without any prior knowledge that she could be at risk. A conversation with a provider who was trained and enrolled in Still at Risk could have led to a better, faster intervention for Danielle. And the potential provider impact here is huge. Frontline care providers like ambulatory EMTs, emergency medicine doctors, nurses, medical assistants, really everybody from first care provider to a woman's OB, everybody should be ready to recognize a mother at risk during the postpartum period. Through Still at Risk, we aim to help patients by helping providers do what they do best, deliver timely, life-saving, and life-affirming care. Thank you so much to HHS for allowing us this opportunity to share this announcement on this platform in front of this audience. Thank you to the entire coalition of collaborators for your support in bringing this initiative to life, and especially thank you to my team at the Preeclampsia Foundation for doing the important purpose-driven work that we do every day to protect mothers and babies. Thank you very much for your time. I'm going to invite a few of our collaborators. They couldn't all be here today, but those who are, to make a few remarks, if they would like, about this initiative and why they have chosen to sign on to such what we believe is such an important opportunity. And I believe Jennifer Brown from the American Medical Association will speak first.
Thank you so much. I bring you greetings from the American Medical Association and our CEO, Dr. John White. This initiative I'm so passionate about because I almost died giving birth to my second son. And so it's very important to me personally, but it's also very important to the American Medical Association. We know the most dangerous challenges in healthcare cannot be solved by one organization alone. They require partnership, they require shared expertise, and they require a common commitment to protecting patients. Preeclampsia is a powerful example of why that kind of collaboration matters. This serious disorder, hypertensive disorder, affects roughly 1 in 12 pregnancies and can lead to stroke and even maternal death if it is not detected early. Recognizing that challenge, the AMA, the American Heart Association, the Preeclampsia Foundation, Premier, the National Institute for Children's Health Quality, and numerous state PQCs came together around a shared goal: helping patients and physicians catch dangerous changes in blood pressure sooner. Each partner brings something essential, from patient education and outreach to contributing clinical guidance, research, and physician engagement that support the use of self-measured blood pressure monitoring. Together, those efforts are helping more patients monitor their health between visits and detect problems sooner. It is a reminder that when medical organizations work together, combining science, education, and clinical expertise, we can confront dangerous health challenges and make care safer for patients everywhere. I want to thank the partners as well as HHS. We are excited to be a part of this, and we look forward to continued collaborations. Thank you.
Hi, everyone. I'm Rachel Sheehan. In my role at Premier, I have the opportunity to support the team who provides assistance to the HHS Perinatal Improvement Collaborative, which consists of over 200 hospitals across the United States. The team at Premier is excited to partner with the Preeclampsia Foundation and the other members of the coalition to implement this program across the country. It is our hope that in implementing this program, we will have the opportunity to increase early identification and timely treatment of hypertensive disorders impacting women during the postpartum period. We would like to thank the Office of Women's Health and the Preeclampsia Foundation for their continued leadership and support in improving care for both pregnant and postpartum women across the country. As Eleni said, the evidence tells us that severe maternal morbidity and maternal mortality happen to be preventable. We will join with the coalition to implement this program in hopes to prevent the adverse outcomes that we are seeing that are caused by hypertensive disorders in postpartum women across our country. We are excited for this program and can't wait for the implementation to get started. Thank you.
Thank you. You already heard me talk, so what I'm going to do is saying thank you to the Preeclampsia Foundation and to these amazing partners. I think this is a wonderful example of how a platform like this meeting put together by HHS allows organizations to come together to share their passion and their mission for something, and we at the American Heart Association are honored to join forces with these great organizations and with HHS to focus on this issue, the #1 cause of maternal mortality, as I said earlier. We have a lot of work to do. We have a lot of awareness to create of clinicians, of patients, and it will take all of us to get that done. So thank you again for your enthusiasm for this, and thank you for your vision in bringing us together.
And Deb Kilday with the Office on Women's Health. We are privileged and honored to be a part of this national coalition. We are excited about the work we are about to embark on. We hope you follow this journey. We hope you join this journey. Again, thank you to all of you for helping us make it happen. And with that, we'll say have a fantastic lunch, and we'll see you in just a little while.